going to ask our three key speakers to introduce themselves and to tell us how they became so involved in the movement to address control of tobacco and control of smoking. In this country and in many parts of the so-called developed world, I think sometimes we think smoking's being dealt with. And I was just explaining to our three speakers that recently we at C3 looked at an area of deprivation in southern Scotland, where 46% of pregnant women booking at the antenatal clinic were smoking. Smoking across the world is responsible for more than 8 million deaths a year. A lot of those due to secondhand smoke. There's one smoking-related death every 5 seconds. And smoking kills more people a year than HIV, TB, and malaria combined. So this is something that shouldn't have gone off the radar, shouldn't have gone away. And really, I think the new big scare, that of COVID-19, is that going to stop us thinking about smoking, or is it going to accelerate the drive? So I'm going to ask our three speakers, starting with Princess Dina Moret, who we're delighted to have here, to tell us why they feel so strongly about tobacco prevention and control, their organisations, and what they're wanting to achieve. But fairly shortly, because they and I are really keen to hear your questions, and we hope you'll start putting your questions on the chat box as soon as possible. Princess Dina, please.
Thank you so much, Christine. I'm so honored to be joining this panel with the esteemed participants. I'm a mother of a cancer survivor, past president of the Union for International Cancer Control, special advisor to vital strategies led by my dear colleague Jose, and now as a patron of SIO, the Society for Pediatric Oncology. The reason I joined the fight against cancer, because I was part of the generation here in Jordan that literally walks in a cloud of smoke. From the moment we were young, we would be running around in our living room, where if we have special guests, you'd have actually packs of cigarettes, not the ones that were generic, the special ones, the expensive ones, put on a silver tray to actually give out to guests. So I was that generation, and it continued. And I was of the few people who absolutely hated smoking. And as a result, Jordan now is one of the #1 countries with smoking rates. You don't even need to see data. You can just see it from your naked eye. And I'm started to be a big anti-tobacco advocate here in Jordan, and of course in the world. And that's why I entered this race, because I am not seeing any improvement here on the ground with regards to smoking, certainly in the Middle East, where we have the shisha, the cigarette, and now the electronic cigarettes. So we'll speak later, but this is my short intro.
Thank you. And I was really impressed when I opened my Guardian a few months ago to see how strongly you were quoted in your own country in the role that the tobacco industry was playing. And I think many of the speakers we have here are only too aware how challenging it is to take on the tobacco industry. So good luck with the fight in Jordan, but also, of course, much wider as well.
Yes.
So shall I move to Dr. Bronwyn King, another fighter of the industry, and also the rest of us are very jealous to learn that she's in 30 degrees C and was interrupted eating ice cream before she joined us. So Bronwyn, envious of your climate at the moment, but over to you to tell us about your work.
Thank you so much, and thank you to everyone at C3, and a warm welcome to all, genuinely a warm welcome with that 30-degree heat to all the viewers today. So my story is that by background, I'm actually a radiation oncologist, and I became a radiation oncologist because my first job out of medical school was working for 3 months on the lung cancer ward at the biggest cancer centre well, it's actually the biggest cancer centre in the Southern Hemisphere, but it's located right here in Melbourne, Australia. And everybody clearly knows that tobacco is bad, but as a doctor on a lung cancer ward, you really get a front row seat to the show, and it is absolutely devastating getting to know people in their 40s, 50s and 60s who are suffering terribly as a result of tobacco. Nearly all of my patients had started smoking when they were very young, as teenagers, or even as earlier than that, even in just childhood. Many of them had tried to quit at some point or another. And many people think that, you know, Australia has a great medical system, and Australians even think, oh, well, surely we can fix everybody. But in fact, when it comes to tobacco-related illness, most people really suffer terribly and many die. And I got to see that firsthand, and it left a very, very big impression on me. And then my funny story, by accident, 10 years later, I was a qualified specialist, and I found out by accident that my compulsory pension plan was investing my money in big tobacco. And that moment just totally changed my life, because I just couldn't sleep at night knowing what I knew about tobacco, and then knowing that my own money was invested in the companies that made the products that were killing my own patients. So I set up a charity called Tobacco Free Portfolios, and I've really devoted my life to that. And that's working with the finance sector globally to ask the finance sector to say no to tobacco.
I think that that's such an interesting story, and I can remember being shocked not long ago, and Bronwyn might reassure me that it's no longer the case, when I discovered my liberal left-leaning local authority had funds invested in tobacco. And when I talked to the UK main NGO, which is quite small, and they told me that at the moment they were campaigning on another issue, which I understood they couldn't fight on all fronts at the same time. But a real shock to realise that people who you thought had the sort of values and commitment that you had were, as it were, taking your money, because I guess the local authority's money is my money as well, in the same way our pension funds are. And I think people are beginning to realise that their pension funds may have all sorts of implications, much broader than just making sure that we all have a reasonable financed old age. That shouldn't be a segue into Jose, but I'm delighted to move to our third speaker, and we have currently one question in the chat, but I'm sure there are more people around itching, but probably at the moment fascinated to listen. So Jose, please tell us about Vital Strategies and yourself and your commitment to controlling tobacco and preventing cancer.
Thank you very much for inviting me to be in this panel. Good morning, good evening to everyone. I'm Jose Luis Castro, and I'm the President and Chief Executive Officer of Vital Strategies, which is a global health organization now working in 73 countries. Our original work started with our predecessor legacy organization, World Lung Foundation, which was formed, to address the burden of lung health in the world, and we found, as was mentioned earlier, that the majority of the deaths caused by are caused by tobacco. But I have a very personal story on how I got involved in the work in tobacco control. And my family physician used to smoke, and I remember every time I went to visit, he would be smoking there, and while examining me as a patient. And then a few years later, I learned, he died of lung cancer. And to me, that was always puzzling to see, a physician, and especially reading the package in the cigarette box that say that it's harmful to health, and then providing advice to me. So I spent most of my professional career working on pulmonary health and tuberculosis control, where we see many patients whose lungs have been permanently damaged by tuberculosis, who are also smokers, and then aggravates the situation. I started very modestly in advocating for stopping smoking in healthcare facilities and also with TB patients. Later, I met Dr. Judith Mackay, who is here, from whom I learned a lot and who helped and was very instrumental in the building of the World Lung Foundation and the predecessor of Vital Strategies and the Bloomberg Initiative to reduce tobacco use. And we've spent the last 15 years working and joining colleagues and my organization. Vital Strategies works with a number of countries to help them reduce the burden, the harms that tobacco causes to their populations, to stop the interference of the industry, and to prevent young people from starting smoking. So thank you for inviting me to be here today.
Thank you. And I think while cancer is the subject of today, the issues around TB are also really important. My understanding is that we are in London are the European capital of TB. Yesterday, I was just walking back from my Pilates session. I drop in my big tick of good behavior on the physical activity, and there was a mobile X-ray unit outside a building that used to be a hostel for homeless people, is now much more mixed use, providing X-rays for people. And I could hear there was a person and a radiographer in the van. Outside the van was the lorry driver smoking under the sign that said what the van was. So we've a long way to go in addressing lung health, and definitely. So we've some questions arising in the chat box. I would take, first of all, perhaps the one from Jane Hill. Jane, are you there? Your question's been up for some while. I think brings us very much into the territory that the whole seminar is about, the recognition of COVID-19 and its impact on this movement to control tobacco and prevent lung cancer. Jane, please ask your question and tell our three panelists whether there's one particular person you want to answer, whether it's all of them.
Oh, good morning, good afternoon. It was to all the panel really. It's more about looking at the pandemic and whether you've noticed any figures or regarding reducing smoking or people stopping smoking or actually wanting to stop. Do you think there's been any impact on the pandemic?
Yeah, good question. That certainly there's been lots of discussion. Not a lot of information that I've seen, but I guess our panelists will have some views and some knowledge. And Jose looks as though he's going to dash in first. So Jose, over to you.
Thank you very much. We haven't seen yet, comprehensive studies about the impact on the reduction of the smoking. But what I can see, for example, in France, where I live, during the lockdown, the tobacco stores were open. And you will see lines that extended, for hundreds and hundreds of meters, to buy cigarettes, and that's quite alarming. We know that the lockdown has a huge impact on the mental health of people, which drives them to engage in unhealthy behavioral practices like eating unhealthy food or drinking alcohol or smoking tobacco. So it is quite alarming to see that governments have allowed tobacco stores to remain open at a time when we're trying to save people's lives and at a time when we're trying to prevent more suffering. I think that when we have more data and after the pandemic, we will have a better understanding of what has been the real impact on smoking. But what we also know is that the industry has been very active and forceful and in advertising and also in infiltrating academia and other institutions, during this time of the pandemic, and that is very worrisome.
That's quite worrying that in France that they think that an essential area is tobacco rather than, sort of closing your gyms, etc., and helping with mental health.
Indeed. Bronwyn, Princess Dino, do you want to come in on Jane's question?
Yeah. I want to second what Jose was saying, the fact that, yes, we don't have sort of the concrete scientific data for what's happening with the academic, but however, observational data, and this is something I'm really, really happy about, that people now are talking about observational data, because honestly, I'm speaking here from the lens in Jordan, for example. The government, when they were blocking, having complete lockdowns, closing supermarkets, closing everything, they've actually had to include tobacco as essential food. And again, in some ways, it is an admission by the government, the fact that this is an addiction, and people who are addicted, it's the #1 country in the world that has extremely high rates of addiction. So in a way you can understand that, and it's an admission by them that they've done, they've categorized it as essential food. But the fact of the matter is, what are they going to do afterwards? We have to take them up on that, the fact that you categorize tobacco as essential food. So what are you going to do about it? This is where you are, having to deal with an addicted population. And I agree with Jane, they've closed gyms, they've closed this, yet selling tobacco is still out there. Really, the COVID-19 has really has really unmasked the evilness of the tobacco industry, and how they prey on economies that are very vulnerable. For example, our government has not been able to speak at all against the industry, because as they were strapped of cash, they were the first to actually pay in advance their tax dues. So, they have been not been able to speak against them at all. And people are still smoking because they are addicted, and they feel, we're worried about our food on the table, our lost jobs, etc. And I think the government is scared to deal with that issue, not to open that Pandora's box. And as a result, you see more and more people smoking. And we will see the results of that. And more people are dying. That's the other thing. They're not really putting it out there in a very transparent way that people who are smokers are twice as likely to die. And I wish they would they would analyze all the people who died, that how many of them were smokers. And this is something we as a local advocates here, we want to get those numbers once the situation comes down, to really showcase that, how much smoking, it makes you vulnerable to other things as well.
I think
so I'm going to pass from Bronwyn, but you might want to come back on that question.
I do actually. Could I just jump in there? Because I actually want to say there is some data. There is some data, and I think it's just worth closing off on that, because I've been quoting it for a while, and I know it's only a survey, so perhaps it's not super rigorous, but The Guardian reported in May that 300,000 UK smokers had quit, and that 2.4 million had cut down. And then in July, there were reports that, in fact, a survey had shown that 1 million people in the UK had quit smoking since the start of the pandemic. Obviously, we're 3 months further on then. And I can give you some data from Australia. So we looked at our quit service here, and in fact found that since the pandemic began, there's been a 400% increase in the number of people contacting the quit lines all around Australia to try to quit smoking. So I think that, we shouldn't be too... I think that there'll be some mixed results in different countries, but I think that when we have this rampant pandemic that has a particular focus on the lungs, I actually think now is the time when we can be very bold in our requests to government, and we should feel courageous when we are going out and asking governments to implement tougher policy, because now is the time. There is a rampant virus everywhere that's terrible for people who have bad lung health, and just maybe you can get some more tough policy across the line. So for example, in Melbourne here, we've got a very strong position on e-cigarettes and heat no burn products. And we were actually able in the City of Melbourne to get them completely banned throughout the City of Melbourne because of the risk of plumes of e-cigarette vapor maybe having COVID in them.
Yes.
And so, you know, we need to be clever as well and strategic, and really everyone's really got health at the front of their minds during the pandemic. And we should, as advocates, use that to try to encourage people and really make them aware that there's never, ever been a better time to quit smoking.
You're right.
And the reason I was holding you, Bronwyn, was I was going to ask Yannick to ask his question, and I'll come straight to you when he does. Yannick, are you there to ask your question? Because we're staying with the tobacco industry and the financing, which is so crucial.
Thank you, Christian. Can you hear me? Yeah.
Yeah, fine. Thank you.
Well, my question was really directing to the whole panel, Jose, Dina, and Bronwyn. And the fact is that we know that the name of the game for the tobacco industry is the money. We have to cut that. And I was wondering, we are talking about raising taxes and so on in every country, or trying to do that. But I was wondering, are there other mechanisms actually where we can just, take the money from those tobacco industry and make them pay for the public health harms and also the economics and the environmental impacts? So that's my first question. And on the second one, I think it's linked also to that. It's the corporate social responsibility that we see from the tobacco industry. They are playing that game to whitewash their image, actually. And we all know that they try to lobby not only public health governments and Ministry of Health and so on, but they also go to other companies. And I was wondering, how can we just impede that those alliances and with marketing companies, social media and newspapers, as you can see, because they are whispering in the corridors, not only of governments, but they're also whispering in businesses. So two different parts of that questions. Thank you.
So I suggested I went first to Bronwyn.
No problem.
Oh, no, Dina, if you want to jump in.
No, you go ahead. You go ahead.
I mean, I think to take the first question there, look, I can see there's very, very decorated tobacco control advocates online, so I feel a little bit out of turn speaking at all. But so there'll be people who will know much more about the master settlement in the USA than I do, but obviously that was a turning point in history in terms of getting the tobacco industry to pay for some of the harms they cause. The thing that always confused me about that was only being paid out in the USA. What about for everybody else in every other country who was suffering as a result of tobacco? And we know that if the tobacco industry had to pay for its costs comprehensively, it couldn't even do that for 1 year, even though the impact of tobacco, if everyone stopped smoking today, would still roll out for the next 40 years. So the fundamental business model of the tobacco industry is unacceptable. It's one where it inflicts catastrophic costs on the world in terms of the health impact, the environmental impact, and yet it just externalizes all of that to the world, yet privatizes a profit. And I mean, obviously, there was the big case in Canada that came to fruition just a couple of years ago, where the people of Quebec sued the tobacco industry to recoup the health costs. Now, I believe that was an 18-year case. The people of Quebec won, but then it was appealed, and during the appeal, the tobacco industry were found to be shifting money out of Quebec. It was brought back to court. They were made to quarantine some money, but virtually, they did some funny legal thing where they basically declared themselves bankrupt and then opened the next day in a slightly different way to get around it. So it was absolutely appalling the way that it played out, but it has inspired Brazil, I believe, to be starting a case. The trick with legal cases are they take a very long time, and historically the tobacco industry has really delayed everything for such a long time and been a very vexatious participant in legal cases. So it's been extremely challenging to do that. But the principle, Yannick, is absolutely correct. Why should we all be paying for costs that are inflicted on us. And those costs have been estimated a couple of years ago. One of them was $1 trillion a year US to the world community. The other estimate was $3 trillion US. So I know they're vastly different, but you can at least agree that they're in the order of trillions. And just the people of the world should not have to pay for that. The tobacco industry should wear that cost on their balance sheet.
And Princess Dina was itching to come in on that question, I think, as well.
Bronwyn has really framed it so beautifully, as she always does. I actually used to use the same lingo when we are advocating here locally. I used to tell people, look, you know, the tobacco industry takes your health, takes your money, completely ready to kill you, basically. And are they ever do they come to you? Do they come and pay your hospital bills when you enter our cancer center or any other hospital? And it used to actually, you know, you could see it would take traction, this argument. Yes, the principle of it is fantastic, and I'm so happy that many other countries are attempting to do that. Yes, it's taking time, but perhaps more and more countries who are able to take on the tobacco industry legally, that would really be great. I wish more and more would do that, so it becomes a norm rather than something unusual. So you know, that's something I'm sure we all would hope for. The other question you had, what was it, Yannick? What was the other question that you had?
It was about
social responsibility. Yeah, I mean, again, they are, you know, there are two lenses I find when we're talking about the tobacco industry. There are countries who are doing extremely well, and there are countries who are, you know, many countries who have signed up to the convention, the FCTC, they actually pick and choose. It's like a menu. They do one thing and then they completely negate it with another action. And Jordan certainly is one of them. We have seen a big rise in corporate social responsibility directly to the community, even though that we have a law that prohibits it. And that's when the Guardian article that you spoke about, Christine, we've outed all of even the government was completely involved. Imagine they had the spokesperson of one tobacco company appearing on the platform of the government. So we've outed that, and I went on national TV and outed the complicit even interactions with the government, with the tobacco industry, whether in corporate social responsibility, and the fact that they interfered in the standards. Imagine in actually laying the standards for the introduction of e-cigarettes and so on. The tobacco industry were sitting right opposite us on the table, actually voicing their views. They're voicing their views, and we, the NGOs, they did not take one single recommendation from us. And it was a really hard fight, and we didn't win. We did not win. So yes, and recently, I think Bronwyn and Jose the same, I've been invited to, I don't know, some media events, like well-known, respectable media events like The Economist or otherwise, where it clearly says in the email that this event is sponsored by Philip Morris International. And I was really shocked. I sent it over to UICC and other partners, really confused, you know, whether this was some bogus email, but no, it wasn't. So I think it's and I was told, I think by Bronwyn and others, that recently more and more media conglomerates are taking money in a very transparent, unapologetic way. I'd love to hear more from the panelists on that.
And I think Jose is ready to come in on that question. So well done, Yannick, for stimulating such discussion, and more to come. Questions are pouring in. Jose, over to you.
Yeah, I mean, I'd like to echo what both Bronwyn and Princess Dina said, and I think one way to make the tobacco industry to pay is to tax the products. I mean, we know that the taxes are a win-win situation. You know, it puts money into the government's coffers to address the damage that tobacco smoking causes and the healthcare costs associated with that. And it also shows that it's an effective tool for reducing smoking. And on the question of social responsibility, It's a very important question you raised, Yannick, because at this time, we know that, Philip Morris International and British American Tobacco are investing on tobacco and on the COVID vaccine. And, this it's clearly an attempt to show that, they are good citizens, but also to profit from the prospects of this vaccine. So we have to be very watchful of their actions.
So there's lots of questions on the chat, but there's also some interesting information for people if you've got time to multitask and look at everything, but we will save the chat. But Patrick Wilson put up some useful information from the UK's National Institute for Health Research, but also asked a question. So Patrick, over to you to ask your question about which countries are most successful.
All right, thanks very much. And yeah, what a fascinating discussion and a difficult challenge. And which countries are doing well in the fight against tobacco? I mean, on the basis of looking for positive deviance and lessons that others can apply.
Right.
Well, I might jump in there because many people think that Australia is doing well, and I think, look, in comparison to many countries, I think we are, but I think that is what motivates me so much to this cause, because when I know that Australia is doing so well, yet I still know that the current government of Australia is a coalition government made of two parties, and one of the biggest donors to one of those parties is Philip Morris, which puts us in breach of the Framework Convention on Tobacco Control. And Australia is often held up as this, global leader in implementation of that treaty. Yet I feel like, we're falling at a pretty basic hurdle there. I also think it's important to know that yesterday in the Australian newspaper was a paid Philip Morris article that was promoting e-cigarettes and heat-not-burn products. And most tobacco control advocates in Australia believe it is in fact in breach of our tobacco advertising regulations. However, the paper came out today and defended that decision. So, oh, I've got a bit of interference there. I hope you can still hear me. Sorry, can you hear me now?
Yeah, you're sounding fine from our point of view.
Okay. And so, so we've got constant pushing here from the tobacco industry, and as Princess Dina was saying, there really has been an explosion of big mainstream media houses accepting sponsorship from tobacco companies, which I know they've been doing it for a long time, but it feels like it's really intensified this year, because I think those national boundaries are perhaps less relevant now that we're all online. We've become so global, and seeing publications like the Financial Times, like Harvard Business Review, the Wall Street Journal, the Economist, Foreign Policy, the Australian. I mean, that's just totally off the top of my head. And I know that all of them have featured articles on big tobacco companies in a positive light recently, or they've given them a platform to speak at conferences alongside very decorated world leaders. I mean, the Economist had Bill Gates and Christina Georgieva headlining an event, and Philip Morris was sponsoring that. So, it's just been deeply disappointing. But I think that the thing that keeps me optimistic is that we can all learn from each other about how to do things well, and about the mistakes that other countries have made. Let's make sure we don't make them. So we don't have to reinvent the wheel. We need to, I think, strengthen our global ties as much as we can right now, alert each other to things that are happening, and use our collective powers as much as we can to push back.
So Princess Dina.
I just have a question to Bronwyn. You said that your newspaper article that gave a full page for Philip Morris to advertise in your paper, you said they defended that. How did they defend that?
Well, today, I've only just read today that the Australian newspaper said that there's an exception to the law if it's for political discourse. But I mean, I think that that's just a loophole that, I mean, you can argue though that it's still, that exception, I believe, still doesn't apply if you're promoting products. And this was clearly promoting heat not burn and e-cigarettes, which, and in Australia, we don't have heat not burn, you know, we've got very strict laws against this. So
but this is why I lose hope. If Australia, who takes on the tobacco industry and takes them to court, and you have a clear law and you actually ban these products, how come? I mean, this is very sad for us, because we look to Australia, actually, even though you think they're not perfect, but you know, Australia is up there when it comes to fighting tobacco.
I remember, and I'm sure Princess Dina and others do, the first of the UN high-level meetings. Australia's health minister said that they were on target to be the first tobacco-free country in the world. So agreed with Princess Dina, this is sad and shocking news, I think.
And I do wonder if they're particularly, you know, if they try to work hard here, because they know if Australia does something, then many other countries will likely follow, like with plain packaging. So yes. I do wonder if they push extra hard in Australia. But, you know, having done a lot of work in our Parliament House in Canberra, every time I'm there, there's tobacco industry people there tracking me. It's, you know, it's not a very friendly place. If I go to any function in Canberra, there are tobacco industry tables at those functions. I mean, I think that it's alarming how much effort there is to disrupt the implementation of the treaty in Australia. It just makes me realise how, you know, this is a very, very big force we're up against, and we need to be very, you know, very determined and relentless in our efforts.
And Jose, and then I'm going to go right back to one of the earliest questions to Katie Cooper. Jose.
The example that Bronwyn mentioned, you know, about Australia and, you know, in the developed world, there are also examples of progress in the low and middle income countries, and, you know, that have, you know, implemented the 5 elements of the WHO Empower strategy and have made progress in controlling tobacco. But again, it's a constant, you know, it's a constant struggle with big countries like India, like Brazil, Turkey, you know, made significant strides. But then you see how the industry takes a small country like Uruguay to court and challenge. And in this case, you know, Uruguay won the case, but it is a constant struggle. There is progress, and we have to, I think, defend that progress continuously so that that it continues to save lives.
Absolutely. And I'm going to go right back, because I think we're now moving close to that territory. Katie Cooper asked an early question about tobacco marketing. Katie, are you?
Yes, I am. Hope you can hear me. My question is about marketing of tobacco. The danger here, I think, that we think we've beaten it because of the Framework Convention on Tobacco Control, but of course we haven't. And my question is really around online marketing. Not necessarily paid for adverts by the industry, but particularly astroturfing, which is where social media influencers are actually paid to advertise products, but don't let on. And this is really quite common in, for example, alcohol advertising. But I was wondering both how common it is in tobacco, but also specifically, have we seen an increase in this since the start of the COVID epidemic, as so many of us are now online seemingly all the time, particularly young people during lockdown. I was wondering if there's any evidence around changes in patterns of social media influences.
Marketing online, is it more? Yeah, please do, Bronwyn.
No, I haven't got evidence, but all I can say is that I think that there's a lot of sort of secret, you know, promotion behind the scenes with influencers who are, you know, clearly placing products in very attractive locations and, you know, putting that out for young people to see. But I think it raises some big issues in terms of, I think we need to get a lot of younger people involved in tobacco control. It would be great to have people in their teens who are actually using these different media platforms all the time. It would just be great to hear from them, so that we've got people, you know, who are the target market on the sort of tobacco control teams and helping us. I also think that we need some of the big media companies to step up, though. We need Google, we need Facebook, we need all of, you know, Instagram. We need them to have tough policy as well, because if they're not aligned with us, then, you know, it's really not going to work. And I know that there are some groups out there working with them, but I think that's going to be absolutely crucial moving forwards. And in terms of what they've been, what tobacco companies have been doing during COVID, I've got a picture here that to remind me to say that, one picture I've been using in my presentations these days is of a very glamorous woman wearing a mask that has a tobacco product name on the mask, and she's doing her weights with her beautiful muscles in her bikini, and she's got this mask on, and I'm sure that I don't imagine that was just a random thing. I think it certainly seems quite a suspicious thing in terms of why she would have chosen to post that. So I think it's a great point, and I'd love to know the other panelists and what they think of it.
So, users of, I'm going to move to a more traditional sort of marketing, because I had a message from a colleague in Scotland who wasn't able to join us today, Claire Cable, who heads up Queen's Nursing Institute in Scotland, which is highly skilled community nurses in Scotland. And she says that she's noticed all across Edinburgh's buses, there are adverts for nicotine pouches, which she says claim not to be tobacco derivatives, but she's anxious that that's not the case. And she says it feels like an unresearched and unregulated potential public health harm. Who knows about tobacco pouches? Right, well, I think unless anybody in the audience does, I think Claire's defeated us all. I'd like to move to, and I'm struggling to read, Imad, a question about Lebanon and tobacco industry, and raises, I think, a very interesting question about the role of governments in many parts of the world, where not only do they have the potential or not to regulate and legislate, but often they control and own the tobacco countries themselves. And Imad, are you there to ask your question? I hope I pronounced your
Hi,
name
everyone.
right. Yeah, great. Hi.
It's a great panel, and thank you very much. I just wondered if we spoke too much about targeting industries and tobacco's manufacturers and stuff like that, but we haven't spoke about targeting smokers and inform them more about the effect of smoking. Sorry. I take my question out of me living in Sweden, for example, when I was told by Swedish people that when they were at schools, they were actually being scared from not brushing their teeth before sleeping. So everyone in Sweden brush their teeth before go to sleep. So why not going that way with the smoking? And on the another question for about the COVID effect on giving up smoking. I'm just wondering if the statistics that were shared earlier, if that was only caused by COVID, or was it as well economic? And thank you.
Yeah, Princess Dina.
Yeah. Hello, Imad. I know Imad very well.
Hi, Princess.
How are you? Actually, Imad, I found, certainly in my advocacy here in Jordan, the whole conversation about what the industry does, it was non-existent. It was only ever discussed, the whole issue, what the industry does, their sneaky ways, etc., was always done just on academic circles, like this kind of forum. But the general public, usually somehow the conversation used to be between, it used to be framed that if, let's say, the government really wanted to do something with the FCTC and they wanted to raise taxes, for example, suddenly the whole framing of the argument would be sort of the individual versus the government. And the tobacco industry was not even mentioned at all about its role. So actually in our own advocacy, we've had to, yes, we do inform the public about the health harms and all of that. And we have programs to go into schools, etc. But I found that I had more traction, even talking to teenagers, when I said, you know, don't be dumb. You are really, you think you are choosing to smoke, but actually you're part of a big conspiracy. The CEO of a tobacco company earns millions at the heels of your health, at the back of your health. And what do you get out of it? They don't even come to sit with you at the hospital or pay your bills. I had more traction when they saw themselves as, you know, cash cows for the tobacco industry. So, but I think, you know, if I'm at, again, the solution to fight the tobacco, very similar to what the FCC does. It's a whole recipe of things that we have to do, from taxes, from informing the public, from stopping advertising. You can't just use the FCTC as a menu. You have to work on all fronts to get the best results. And certainly, I think in the Arab world, the role of the industry and the complicit interactions of government with the industry, that hasn't been a conversation that has been very transparent and actually there on the arena. So you might want to also talk about that also in Lebanon, because, you know, as well as educating the public.
Thank you. Jose, you're...
Sure, no, and I echo what Princess Dina said. Imad, we also, you know, Vital Strategies have worked over the years in developing hard-hitting mass media campaigns, you know, to educate the public, to reach to the public and educate them about the harms of tobacco, the harms to themselves, to their families, and communities. And those have been very effective in around the world. Some of those you can access them, you know, there are resources that are available for advocates around the world, and you can access those through our website or by contacting us for these mass media campaigns. They are available in multiple languages.
Thank you. And I'm going to move to what I think might be more or less the last question from Rodrigo, changing the message a little to look at workplace, which is a key area for opportunities for prevention. Rodrigo, over to you.
Yeah, thanks. I work with a lot of multinationals around the world, and they've said that, you know, regardless of their industry, they've all had to become a healthcare company now with COVID. Meaning that they are now having discussions at the C-suite about, you know, healthcare related issues of their employees. And so I think it's a silver lining and a great opportunity to expand the discussion beyond COVID to a wider conversation within these communities and these large organizations to focus on chronic non-communicable diseases such as, you know, tobacco control. So I was wondering if the panel or anybody, you know, had any thoughts on how we could leverage these conversations towards tobacco control given the current climate.
Yeah, good question. Certainly in the UK, we've been running some workplace health seminars with the Society of Occupational Medicine here. And also yesterday we had a lot of conversation with some of the people involved in the people of the NHS and their health and well-being. And there has certainly been a massive increase in interest in health and well-being of employees under COVID. How much of that has translated into any suggestions about considering smoking and working with employees? I'm less aware, and I guess increased working at home probably increases for those smokers the opportunities to smoke, which in this country and many others, you're not allowed to do at work. But when you're at home, yeah, anyone with thoughts on Princess Dina?
Yeah, I think I agree with Rodrigo. You know, corporations really are well placed to make a big drive with regards to tobacco. And certainly we in Jordan, we really tried, when I was former director of the King Hussein Cancer Foundation, we worked a lot with companies to try to, we've made a prize for them who are smoke-free places, and many companies, it has improved, I must say. Many companies are now more and more making sure that smoking is not allowed at their premises. Still a small portion, but the movement started. I really think that this could be a new venue to urge corporations, in the same way as Bronwyn did with the insurance industry, that there are people, CEOs of corporations who are willing perhaps to lead the change if we were to ask them. In the same way that when Bronwyn started to knock at the doors of these big insurance companies, they were not aware about how effective or their role would be, and they responded. So this could be an area for advocates also to, work on corporations to make permanent changes beyond COVID.
Yeah, and if I may add to that, many places around the world really have become smoke-free places, including the places of work where people spend most of their waking hours. So yes, the employer has a great deal of influence on the behavior of its employees and promoting healthy behaviors. I mean, we tell employers tell their employees at what time they should work and how they should dress, so they can also advance those healthy behaviors and making clear what the harms of tobacco are, and discouraging them and their families from using the product.
And if I can just sort of just add there, I think I really echo those statements of Jose and Princess Dina. I think maybe this is a great moment for us to jump on in the tobacco control community, because leaders of corporations have never been more health literate than they are right now today. They've learned all sorts of words. They know more about vaccines than any corporate CEO would ever know ever. They know all sorts of things about viruses and pandemics. I mean, come on, think of all the language that we've all learned this year, but the business sector has had to come along and learn that as well. Also, every business has to have, certainly in Australia, has to have a COVID safe plan now. It has to have a plan. I'm on the board of a few organisations, they have to have a plan. And so maybe, I mean, just brainstorming here, but maybe it should be an integral part of the plan is that you encourage all of your employees to not smoke, and current smokers need to be offered quit services. In the same way, in Australia, almost every single business is offering support for mental health troubles at the moment. There's been we understand that now is a very challenging time for mental health. So businesses are almost all providing a paid service for their employees to access mental health support. We should actually advocate for quit services to be built into a COVID safe plan, because if you want to be a COVID safe workplace, surely it makes sense that your employees are not smoking. And if you had employees who were smoking, they're putting others at risk as well. So it's not just about the individual, it's about the whole office, it's about the whole community. And I think actually it's maybe now is a moment that we can use as a to really leapfrog those discussions forward.
Do any of the panelists have knowledge or evidence of how the tobacco companies themselves behave in this territory in terms of employee health? Some years ago, when Katie Cooper was working with us, we tried to find out whether you needed incentives to work in tobacco companies in countries where people are really hostile generally to smoking. And whether there were pay differentials, and what's it feel like to work for a tobacco company and constantly hear the criticism. And we found it almost impossible to find out, but it would be quite interesting if anybody has information. Bronwyn,
I can offer you some thoughts there. I mean, we know that you can earn 3 to 4 times as much doing the same job, but doing it for a tobacco company. So we're aware that there is a massive price increase. In Australia, there are many sort of sham companies that are set up, and people work through them so that they can keep their curriculum vitae or their resume clean, because it is looked at with such distaste in some parts of the world that if you have that on your CV, you need to make it disappear, because no one will really consider you as an ethical employee, and it will affect your future job career, your job choices. But one thing I can say, I have read a fair few annual reports of tobacco companies, and I know that, you know, in one of them there were pages and pages written about the very tragic deaths of some tuk-tuk drivers in India who died whilst delivering tobacco to the retailers. And the reason I know that for sure is that the same report contained absolutely no mention at all of at that time, if you look at the market share and the number of deaths that year for tobacco, I calculated that according to market share, that particular company had made products that had killed around about 800,000 people that year. They weren't mentioned at all in the report, but they did mention there were 4 tuk-tuk drivers who had tragically died, and there were pages on how they were going to change policy to look after their own staff. But at the same time, I'm just remembering here, and I know that my colleague got me this nice slide saying that here there were a significant number of COVID-related deaths in a tobacco factory in Indonesia. There were also Zambian farm workers risked their health during the pandemic. So actually, those are just reading headlines off articles that have come through during the pandemic. So I think that, you know, I'm sure that there are other people out there in this audience who might be able to offer more, but those are just some thoughts off the top of my head.
I've been a terrible chair and been so fascinated, took my eye off the time. And I'm conscious we ought to have ended, but I'm not going to end without inviting each of our panelists, not only to give their final thoughts for all of us here. And in fact, we've lost almost nobody even though we've slipped past 9:30, but also what one thing would you suggest, say for C3 as a small engaged organization, what's the one thing we should be trying to do as a result of hearing you today? So who'd like to go first? Your thoughts, your final thoughts, and a recommendation. Princess Dina, thank you.
I think from hearing everybody talking, we need to, I would love to see your organizations and many other global tobacco advocates to really keep on synthesizing what's happening in real time. Sometimes I find, you know, we're so worried about having the rigorous scientific data that, you know, people die until it comes out. I think we need to keep on bringing it to the forefront of the fact that smokers are vulnerable to COVID, vulnerable to cancer, vulnerable to NCDs, makes you vulnerable for all these things, somehow to keep synthesizing and bringing out the real data. So we don't just wait for the academic rigorous studies to come out. It might be too late. That's one of my thinking.
Thank you. And thank you for your participation today. It's been great. Jose.
Sure. I think that COVID-19 has put a tremendous burden on the health systems. And it's an opportunity also for us, those working on preventing diseases, non-communicable diseases and tobacco and the risk factors like tobacco or sugary drinks and unhealthy diets, to step up our work. I think that the good thing about COVID, if there's one thing that we can say, is that it has brought attention to the world about the state of the healthcare system in countries, and it's not good. It's stretched, and we have to work to build that, to invest and to support the efforts of prevention, because we know that prevention is the surest way to prevent disease, to prevent suffering, and the astronomical healthcare costs that are now faced by many countries.
Thanks. And Bronwyn, your final thoughts and recommendations for C3 to get more active.
Thank you. I mean, I think my final thought is that this year we're going to see 8 million deaths from tobacco. This is a problem that's catastrophic in the number, the scale, the complexity, and I think my recommendation is to everybody to use this very unique moment of time to be as strategic as you can to try to creatively advance tobacco control, because even just in the conversation, I think some new ideas have arisen that I hadn't thought of. So I think that it really shows we need to use every bit of energy we have and continue collaborations and brainstorming at events like this so that we can get together and share information and share ideas. And if I have one special request, please ask for a tobacco-free pension, because everyone in this audience, if you're working to do good things in health, make sure your own money is not invested in tobacco companies.
Thank you. And a really big thank you to our 3 panelists, but also to all the participants, many of whom read like a list of the C3 friends, family, past, current, and almost future. Thank you to the panelists for being brave enough to have no prepared presentation. And despite a nervous chair, both the 3 of you and our participants have made, I think, one of the most interesting, exciting seminars that we've ever had the opportunity to host. And so a very big thank you to everybody. Stay safe from COVID, but remember that if you smoke, that's much more dangerous than the coronavirus. Thank you all, and good week, and good luck to London Global Cancer Week for the remaining days and opportunities that exist. Thank you and bye-bye.
Thank you very much, and success. Bye-bye.
Thank you.
Thank you. Thank you.